TAVR is a modality which is widely used in this age group, referring to patients above the age of 80 or 90. And it is an extremely successful procedure in this age group with a procedural success rate of above 90%. Studies clearly favor this therapeutic modality in this age group. And the problems that occur are few and far in between in this setting. It's important for us to remember that after all, age is a number and the elderly have a right to quality care and quality of life too. In fact, these are the patients who derive the maximum benefit of TAVR. It is these patients who are extremely weak, frail, who have a very poor hand grip, extremely elderly, or who have multiple other medical conditions like kidney disease, diabetes, or other, say, heart failure or other comorbid conditions. These are the patients that are extremely high risk for a surgical procedure. So it's difficult for a surgeon to actually go in and take out the valve and replace it in this sick subset of people. So it is TAVR here would actually score very highly because you are able to do these procedures in these sick people without having to have them face a very high morbidity and mortality. So they do much better in this non-surgical procedure that is TAVR compared to surgery. So in short, these are the patients that benefit maximally from TAVR vis-a-vis the surgical option. I think this is a very, very pertinent question. How do we ensure safety? Because safety is paramount and safety is the most important thing for the patient, family, the doctor, and the entire community. So the best way to do it is to pay attention to every single detail, to take care during the entire procedure, to make sure that the procedure is absolutely nothing extra is done. Make sure that the procedure is uneventful by choosing the right device, by doing everything with extreme care, and to keep the procedure as short as possible. And it's also important in patients in sick patients with multiple comorbidities to make sure that we prepare the patient well. That is, you spend a day or two, get them adequately treated for their heart failure, get them adequately treated for their sugars, for their pressures. Make sure we make them better candidates before they enter the operating room. TAVR in the younger group of people, that is TAVR less than 75 years. This issue has actually generated significant debate and has culminated in a lot of discussion and resulted in the continuous evolution of the guidelines. What is very clear, let us be clear on this, is that the age group has continued to move downwards. Before we were doing TAVR only in extremely elderly, then it became elderly, then it became indicated in patients who were not so old, and slowly the guidelines are changing. However, current guidelines say that TAVR should only be done in patients who are above 65 or who are below but who have some compelling reason to do it. So this is because we have to keep in mind the long-term durability of these valves. After all, these valves are tissue valves. So we have to keep in mind the long-term durability of these valves, and we also have to keep in mind that these patients are going to live much longer, and therefore we need to address this issue, keeping in mind that lifetime management of aortic stenosis is going to be very important.